One of the cool things about ophthalmology is that if you look at all of medicine, medicine has a lot of different fields, right? So you have pediatrics, neurology, psychiatry, trauma surgery. All of those areas of medicine are actually replicated in the field of ophthalmology. It's just that we have small little subfields of ophthalmology dedicated to them. So we have pediatric ophthalmology. We have oculoplastic surgery for the plastic surgeons. We've got glaucoma. We've got retina. We even have fields that mirror less well-known areas of medicine, like ocular pathology and inherited retinal diseases. So there's all sorts of different specialties within the field of ophthalmology. And then even within that, I think that there's a ton of variety in terms of what people decide to focus on. So some people are just busy clinicians. Some people really focus their time on private practice and seeing patients and performing surgery. Within academic medicine, you can do research, you can do education and teach, either medical students or residents or fellows. There's even other areas like international ophthalmology is a big area. We have individuals who go into business and do entrepreneurship within medical devices or drug delivery and ophthalmology. So there are all these different ways to be involved in the whole ecosystem as an ophthalmologist, and as a field, I think we've got it all.
Yeah, so I spent a year in private practice after fellowship, and then before coming to Mass here. And I have to say, it was a great year. And I've told the residents I grew a lot as a surgeon and a clinician, because it was the first time I was truly kind of on my own, in private practice. And, there's a large variety of private practice too, and that's a different conversation. But in private practice, typically you're kind of on your own. You're seeing your patients on your own. There's no resident, there's no fellow, there's no colleague across the hall that you can go have them take a look at a patient. There's no cornea fellow on call who can come. So in that sense, it's very different. It's kind of you have a lot of independence to make decisions about patients. At the same time, it feels fulfilling. A lot of the patients I was seeing in private practice in the suburbs, were elderly, couldn't come into the city. So you do feel like you're providing a service to patients that could otherwise not see you if you were here in the city and could not come to you. I would say the three main differences are teaching. In most private practices, they don't have residents or fellows, and that's something I miss dearly when I was in private practice. And I love working with the residents here. And as Dr. Tiger said, our senior residents are fantastic. And I love working with them in the operating room and in clinic. I think research is another thing. And again, it depends. Some private practices allow you to do research, but I would say harder overall. It's so much easier to start a research project here, in an academic institution than it is in private practice. And the third thing I alluded to earlier is working with your colleagues. I feel like here it's so easy to involve anyone, like retina, cornea. If I want to do a Parsplana tube with Dr. Miller, it's like so easy to make it happen, and it's definitely a lot more complicated in private practice. But I mean, they both are very important, and I think they're both great. So it just depends on what you want and what's important to you.
Obviously, the American Medical Association is the largest physician organization in the country. It represents not just ophthalmologists, but all eye doctors, all doctors across the country. And so it is a really great institution to be a part of. During COVID, they fought successfully to try to get physicians the right to wear their own PPE at various hospitals without losing their jobs. They wrote a New York Times opinion piece about how COVID was affecting underrepresented minorities and brought that to the forefront, and that became like the main topic during like a whole month of COVID crisis. So the AMA is doing a lot of different things. As an ophthalmologist, what can we do for advocacy? I'd say we have like a huge responsibility in terms of being at the forefront of what is going on in the world of advocacy. So here's some examples. So ophthalmologists are pretty tech forward people. I'm starting a tech company. A lot of people in ophthalmology were, early adopters of things like OCT. We also recently had the very first FDA-approved device that does artificial intelligence for automatic detection of disease inside of a body without a human looking at that image. We have the very first viral vector for gene therapy, and the very first injection of that was FDA-approved was actually at Mass Eye here. So ophthalmologists are always at the forefront of where medicine is going. And because we understand where it's headed, we have a responsibility to educate our peers and prepare the health system for what's coming. So whether or not that's preparing insurance providers to cover these services for their patients, or talking to various government officials about how important vision is. I mean, it seems obvious, but vision is like a hugely important thing for people to be functional in the world. And it's funny because a lot of advocates go to Capitol Hill and have a really easy time talking about vision because everyone has a grandmother with cataracts, or everyone has had someone in their family that had some eye condition and they can relate to that. So ophthalmologists do have a strong role to play in all of that. One thing that I just wanted to mention, and thinking about this a little bit, I mean, we're lucky at Mass Eye and Ear that we're not just like a standalone little eye clinic. We're connected to the broader Partners Health System, now called Mass General Brigham, and so we're connected to like the best services of all these different subspecialties, and we get to consult and work with them. So in the same way that the AMA is like this group of all the doctors coming together, Mass Eye and Ear is situated such that we're central to this large institution. Not only that, but like the Harvard network is insane. So we have the Harvard Business School, School of Public Health, we have like urban development and design, city planning, we have the Arts Institute, all sorts of researchers across the institution. Then we have MIT across the river, where they have, you know, computer scientists and people working on AI and developing cool new technology. So we're kind of at the hub. And in fact, I don't know if people know, but OCT, which is now like standard of care, was invented right across the river at MIT. I think they came over and used one of the eyes from the eye pathology lab at Mass Eye and Ear for the very first paper on OCT's effectiveness. So we are really at the forefront of ophthalmology. And so advocacy is just a portion of that, but I think that it does highlight also how cool our institution is.